I'm Zach. I'm going to be showing you how to give a piggyback secondary infusion today via IV. First I'm going to perform hand hygiene and take a look. I already compared my MAR to my physician's order. So then I just have to complete my first check. I'm giving for Erica here, I'm giving, she is allergic to shellfish, so we keep that in mind. And she is getting methylprednisolone. I retrieved my medication. I have methylprednisolone, 125 milligram vial, and I'm giving 50 milligrams IV via mini bag, Q6 hours, and the time is now that I'm giving it. So now that I've completed my first check, I now proceed to my PDM to begin to dilute my medication vial. So then after reading the PDM, I saw that for 125 milligram vial, I need to inject 2 mLs of sterile water. So I grabbed sterile water, and then for a final volume of 2 mLs, and the concentration will be 62.5 milligrams per ml. So then I calculated it, and I need 0.8 mLs according to that concentration. So I'll get 0.8 mLs of methylprednisolone to put in my mini bag. Okay, and then so what I first have to do is get my 2 ml syringe, or my 3 ml syringe, to get 2 mLs of sterile water. So then I will, getting a fresh new one, I would then peel it back, take it out, making sure to keep it sterile, then grab a new blunt fill, pull the peels back, attach it aseptically to avoid contamination, and then I would then alcohol swab the top of my vial of sterile water for 30 seconds, and then I will then retrieve the amount that I need. Two mLs. Okay, perfect. Make sure there's no air bubbles. Okay, perfect. So then using the scoop method of contaminating, I would then indeed have 2 mLs in my syringe. So then now I'm going to alcohol swab the top of my methylprednisolone vial for 30 seconds, let it dry for 15, and then I will then mix the 2 medications together. Perfect. Moving this, I'll put this in the sharps container to avoid injury. And then I will roll it in my hands to make sure that my solution is completely mixed together. Make sure there's no clump sticking to the wall or anything so I don't lose any dose. Okay, so then now I have my vial, I need to retrieve the dose. So then I'm going to be using a 1 ml syringe to retrieve my 0.8 ml dose. So then I would then peel it back, make sure not to contaminate the tip of the syringe, and peel back my blunt fill without contaminating the tip. Pull it back, leave that all the way. I would then have that open, and then without contaminating my blunt fill, I would then alcohol swab again for 30 seconds, let for dry for 15, and then now I'm going to retrieve my dose, so 0.8 mLs. Perfect. So then I will inject that amount into the vial. Perfect. Okay, so then I have a little bit extra, so I would waste that in bed waste. Make sure I'm avoiding any air bubbles. No air. I would then, using the scoop method, avoid contamination. So then as you can see, I have 0.8 in my vial. And then now I can do my second check, but first I would need to make my med label, which I've pre-made. So then using this, I will then do my second check. So I have Erica ear, I'm giving methylprednisolone. I have the right medication, methylprednisolone. I'm giving 50 milligrams, and that is within the proper range according to the PM for a single dose. And then I already calculated that I'm using 0.8 mLs via the concentration from my mixed reconstituted vial. So then I need 0.8, and I have 0.8. And then the time I'm giving it via mini bag, Q6 hours, and the time is now to give it, and the date is today. Okay, so then since I'm giving it via mini bag, I need to put it in a mini bag. So then, according to my PDM, it says I can mix it within normal saline, either 50 or 100. I'm going to use 100 mLs of normal saline. So I check to make sure that the solution is correct, that there's the integrity of the bag hasn't been compromised, and that it's not expired. I will then proceed to hang it a little bit off the table, alcohol swab the outside for 30 seconds, let it dry for 15. How much time?
I still have 10.
Okay, so then I will then leaving it sterile because of or aseptic because of the alcohol swab to get rid of any microorganisms or most of them. I will then keep it sterile and inject my 0.8 for a total of 100.8 mLs in the mini bag. So then for the Baxter pump, I can only put in 3 digits, so then I'm going to round that up to 101. So that way I can find my flow rate, because it said give it over 15 to 30 minutes. So then I use those 2 numbers to calculate my flow rate. So then 101 over 0.25 hours is 404 mLs per hour. So that's going to be my infusion rate that I'm going to be giving. Okay. So then attaching my med label and the label line, I will then press the medication to make sure that it is completely diluted and mixed together and reconstituted. Okay, and then I just need to bring my line with me, my medication, my MAR, an alcohol swab, and my PDM if I so need it. Okay, so then entering the room with all these things, I do a quick safety check, make sure the patient isn't in any distress, and that the infusion rate for the primary line is infusing at the correct rate, and that we're giving sodium chloride, 0.9%. So then that primary infusion is compatible with the secondary infusion we are going to be giving, so that's all right. The line is unclamped and it is infusing at the proper rate. I'm going to just quickly check the IV site, make sure it is patent and that there is no redness, swelling, or edema, and that the infusion is indeed going in. It's not interstitial or anything. I'm just going to introduce myself first. However, I'm going to say I'm Zach. I'm a student, third year nursing student. Can I just check your ID band? Okay, perfect. Comparing it to my mark. And can you tell me your name for me? Okay, Erica Ear. Perfect. And your date of birth? Okay, perfect. That matches with your armband and your mark. Okay. And can you tell me if you have any allergies we should be aware of? Shellfish, okay, we have that on your band and your mark, so we have allergies in mind. Okay, so today I'm going to be giving you an infusion of methylprednisolone, and that's going to help reduce some of the inflammation that is occurring because of your condition. And I also chose a 100 ml bag because that will help with the fluid deficiency that comes with her diarrhea. Okay, so then first, before I begin, I just need to complete my third check. So then I have Erica Ear. Erica Ear, I'm giving methylprednisolone. Methylprednisolone, I'm giving 50 milligrams IV, Q6 hours via mini bag. Okay, and then I have a total volume of 100 mLs of sodium chloride, and then I have 0.8 mLs of my methylprednisolone, and that is correct for a total of 100.8. And then so I'm also giving the medication today, and today is the right date, and the right time is now. So I will be giving this medication. So first, I will then, I have to prime my secondary tubing, and then I'm going to be using the port that is behind the Baxter pump, so then the Baxter pump can actually control and do the infusion rate that we want to complete. So then I will alcohol swab the top for 30 seconds. But if not, like if I should actually undo this cap first, maintaining sterility, and then I will then, without touching that, I will then alcohol swab the top of that without touching it, and then I will then attach the tube aseptically. Okay, and then now I just need to make sure it's unclamped. Perfect. Close the clamp. Make sure there's no air bubbles. Perfect. Okay. And then just have to empty some of this from the drip chamber. More. Perfect. Okay, so it's about 1/2 full. Maintaining not to contaminate the tip of this. I need to then not contaminate this part, leave it open, and then attach the two aseptically until I feel drip. And then I also there was no hook in my kit, so I need to just grab a blue hook. To be able to lower this bag, because my primary needs to be lower than my secondary. I will then label my line so that the next healthcare provider knows how old this line is, date, time, and my signature. Okay, I will then make sure to check this date and time of my primary infusion to make sure the line is still okay as well. Okay, and then it's about half filled, so that's good. And then I have my medication label attached. So then all I need to do now is put in my infusion. So I'll go to secondary. I'll put in my infusion, which I calculated to be 404. And then I will then put the volume to be 101 because I need to round up because it can only put in 3 digits. And then I will confirm my secondary. I will then unclamp it to make sure the infusion can run. And then I will begin my secondary infusion. I will then check for 3 drops, 1, 2, and 3. This will be 3, perfect. Okay, so then at this point I will then make sure the patient's comfortable, tell them that I will be back to see if you feel any nausea or any feeling of unwellness, but we shouldn't run into any problems because the PDM said that there is only long-term side effects associated with methylprednisolone, and because we're giving the short-term, we shouldn't run into any issues, and we are giving the proper dose, so there shouldn't be any cardiovascular repercussions. Okay. So then I will put the bed in the lowest position, make sure they are comfortable, and then I will document the MAR with my name, designation, and time it was given. And then I will do an exit safety check and come back when the infusion is done.